So without waste of time, we would like to take the next presentation, which will be on recognizing traumatic brain injury as a notifiable and chronic condition towards the World Health Assembly speaker for this topic, which is very important because imagining recognizing traumatic brain injury as a notifiable condition, this can mean proper estimation of the burden in the world, and this can mean better management and approaches. So we will have the privilege to be presented to have this presentation by Dr. Almas, who is an associate professor of community medicine in Northwest School of Medicine. She's also an associate director of global surgery at Alliance Healthcare. Dr. Almas is a global leader for community engagement and involvement. She's a key member of the G4 Alliance, advocating traumatic brain injury as a notifiable condition. So we'll have to learn more from her rich experience. Hello, Dr. Almas Khattak.
Hi, thanks, Franklin. Can you hear me okay?
Yes, we can hear you.
Yeah, and can you see my slides as well?
Yeah.
Yeah, okay, thanks. So good morning, good afternoon, and good evening, everyone.
Yes, we can see your slide. Maybe just try to next. Let's see.
Yeah, okay. So my name is Almas Khattak, and I'm representing the Global Coalition for TBI and the G4 Alliance Working Group. So today I'll walk you through our global effort to recognize traumatic brain injury as a notifiable and chronic condition, and how this movement is progressing toward a formal World Health Assembly 79 resolution in May 2026 that the coalition is anticipating. So as the two profs previously discussed the impact of traumatic brain injury and neurotrauma. So I wouldn't go into more details, but just quickly, this slide presents some basic information about the implications of TBI as mentioned already. As every year, 69 million people sustain traumatic brain injury globally, which is roughly the size of population of UK or France. And economically, failure to act will cost the world estimated $4.4 trillion between 2015 and 2030 if action is not taken to recognize TBI. Even the burden is uneven, as 89% of all TBIs occur in low and middle income countries, where trauma systems, surveillance mechanisms, and rehabilitation services are the weakest. The most common causes, as Prof. Gaji earlier mentioned, are road traffic accidents, falls, violence, and firearms. So overall, TBI is common, costly, and catastrophically neglected. And for decades, TBI has been framed as an acute event. The patient arrives, receives emergency care in the hospital, and is just discharged. And in most cases, as we see, the case is closed. But then this narrative has now been shifted, TBI being considered as a lifelong chronic condition instead, where survivors can develop cognitive decline, epilepsy, depression, behavioral changes, and chronic disability. Many cannot return to work, and not only the patients, but families often carry the emotional and financial burden of the traumatic brain injury that the patient is suffering from. That's why our work is based on reframing TBI from an event to a chronic disease requiring long-term coordinated care. Despite its scale and huge implication, TBI is largely, as previously mentioned, invisible in national health systems. There is no standardized reporting. Trauma data, rehabilitation data, and primary care data, they are set in isolated in systems that do not speak to one another. And without data, as we know, there is underfunding, weak policy, and limited political attention. So this vacuum leads to underestimation, fragmentation, and lack of coordinated long-term care. As the result is predictable, TBI remains everyone's problem, but no system take accountability. So we believe that the policy solution is simple but transformative to make TBI a notifiable condition. Why notification matters to us? Notification means mandatory reporting of every TBI case into a national registry. Once a condition is counted, it becomes visible. Once it's visible, it becomes actionable. As Dr. Khan, Professor Khan from our TBI coalition usually keeps saying, what gets counted gets funded, and what gets funded gets fixed. So notification will also enable us real-time surveillance to identify hotspots, causes, for example, road traffic accidents, and it will help us in evidence-based policy for targeted road safety laws, trauma planning, rehabilitation investments, and much more. It will also help us mobilize resource allocation and stronger prevention in long-term care. So making TBI notifiable will be the entry point to building a national TBI response all over the world. Now, to make TBI recognized as a notifiable and chronic condition, the Global TBI Coalition came into existence. It all began, as Prof. Figaji mentioned earlier, informally in Cambridge in 2023, when both Prof. Tariq Khan and Tony Figaji discussed why TBI cannot be notifiable. That is how the initiative began and is now embedded within the G4 Alliance working group with more than 185 individual members and 35 plus global endorsing organizations. Our mandate includes surveillance and data, policy harmonization, communication and advocacy, strengthening global partnerships. We meet every 3 weeks in scheduled Zoom meetings to plan for global recognition of TBI through a resolution from World Health Assembly. This photo is from our first event this past May in Geneva at the sidelines of World Health Assembly 78th session. And we dearly missed you, Prof. Figaji, in this photo, but the logo that you are seeing on the top right corner is created in your honor, with the globe shown upside down and the creativity being shown by Sanya, Brandon, and Sarah. So our governance model of the TBI coalition includes a main working group of the G4 Alliance, with sub-working groups now being formed on policy, CEI, and persons with lived experience and communications to ensure that technical, political, and human perspectives are fully represented. And the group works, different teams of group, the whole group works to draft global position papers and commentaries. It has drafted the WHA resolution in coordination with the sponsoring who have agreed to sponsor the resolution, member states, and also to include person with lived experience, their storytelling at global events in the form of videos, written testimonials. So in the last 2 years, we have seen extraordinary diplomatic progress. Pakistan and Indonesia have stepped forward as primary sponsors. Several countries, including UK, Norway, Canada, Central African Republic, Rwanda, Benin, and Colombia, have been engaged and are hopefully expected to contribute to shaping the resolution and be the co-sponsors as well. We have also secured support during the WHO Eastern Mediterranean Regional Office and Western Pacific Regional Office, their committee meetings. So now 2 major WHO regions are fully supportive of the resolution and included TBI on their regional meetings agenda as well. Meanwhile, the number of endorsing organizations has grown beyond 35 global partners. This momentum is, of course, critical and to move forward for recognizing TBI as a chronic and notifiable condition from the World Health Assembly. These are some of the endorsing organizations, as you can see. These range from academic institutions to hospitals to NGOs to brain injury consortia. As you can see, Brain Injury Australia, Brain Injury Canada, Brain Injury Ireland, and Brain Injury Association of America, and many more. So along with the significant political and technical momentum from ministries and global organizations, central to our work is community engagement and involvement, especially the leadership of people with lived experience. Our approach moves beyond traditional tokenism. People with lived experience are not guest speakers in our events. They are co-chairs, advisors, and strategic voices within the TBI coalition. We have engaged FIFA as well because we believe elite athlete narratives have visibility around the world, which we need, but we also know that they have not shifted policy as yet. So policymakers respond most strongly, as we believe, to everyday survivors, people injured in road crashes, domestic falls, workplace incidents across both LMICs and HIC context. That's why our goal is authentic storytelling grounded in the lived realities, resourced and supported for global advocacy. Importantly, our persons with lived experience advocates speak at all coalition meetings arranged by the arranged around the world. So to strengthen the community engagement and involvement-driven human narrative at the upcoming 79th session of the World Health Assembly, where we are anticipating the adoption of the resolution, we are building the WHA79 storybook of persons with lived experience. By March 2026, we aim to compile 30 additional high-quality testimonials complementing the 10 to 15 we already have, which we presented at the WHA78 side event. Each coalition partner in the next meetings will be invited to contribute at least 2 stories, ensuring geographic, cultural, and clinical diversity. This storybook will be released digitally and in print for all Geneva delegates, which will be a powerful reminder that TBI affects families, education, employment, and mental health alike. It will position the CEI and lived experience as evidence, not anecdote anymore. But we also know that meaningful CI requires equitable participation, and participation requires funding, of course. To ensure that everyday survivors can attend global meetings, including the upcoming WHA79, we have developed a multi-pronged financing model. We are going to request all our coalition members, which are individual 185 members, to contribute internal voluntary contributions towards the PWE inclusion. And we have also managed the G4 Alliance sub-fund, which is specifically for TBI and persons with lived experience. Professor Gail Russo, our chair of the board of directors, she has already pledged $2,000 to that fund, which will be specifically used for persons with lived experience, travel, and their participation in global advocacy events. We are also looking at corporate sponsorship, especially from industries tied to road safety, transport, and occupational health. We are going to request and ask, for example, airlines. For example, if we have an event, upcoming event in Geneva, we're going to ask them to help us, a person with lived experience, travel to Geneva, where they can also be acknowledged as being partners with us. With all this traction, so what World Health Assembly resolution will achieve? The resolution we are working toward will deliver 5 transformative outcomes: global political recognition for TBI, strengthening of surveillance, catalyzing national policy, unlocking international funding for trauma rehabilitation and prevention, and to help us institutionalize lived experience, ensuring that survivors shape services at every level. This resolution also aligns directly with World Health Organization's priorities regarding their brain health initiative, because their brain health unit is already on board with us, Rehabilitation 2030, and universal health coverage. This is the framework that will help countries implement. If our proposed resolution is adopted, countries will follow a stepwise approach: add TBI to national notifiable disease lists, establish a national TBI surveillance registry, integrate trauma emergency rehab and community data sets, strengthen the trauma rehabilitation continuum, resource the CEI structures and survivor groups, report annually to WHO using standardized indicators. This will create a clean chain of logic from notification to data to policy, care, and accountability. Our timeline is clear. From in May 2025, we have already launched our campaign at WHA78. In October 2025, we delivered regional statements and consensus building at EMRO and WIPRO this past October. And in January 2026, we anticipate WHO Executive Board consideration of the resolution. In May 2026, of course, formal adoption of the WHA79 if we are successful. Finally, I would like to say 2026 is positioned to become the year of TBI with global alignment on surveillance, prevention, and lived experience. Our ask is simple and urgent: support and help us secure co-sponsors for the WHA79 resolution, get us endorsements from your respective organizations, support national surveillance efforts in your countries, and most importantly, center persons with lived experience and CEI in all national and global planning. We all know that TBI is preventable, chronic, and life-altering. Recognition is the first step to accountability, and notification is the key that unlocks evidence, resources, and long-term care. I would like to thank the G4 Alliance, the NIHR ABSI group, all coalition partners, endorsing organizations, ministries of health supporting the resolution, and above all, the survivors and caregivers who guide our work. Thank you, and waiting for any questions.